Hi, I'm Diana Crane, and my proposed project is the Hospitalized Elder Life Program. The HELP program was designed to help implement a group of interventions in order to prevent hospitalized delirium in the geriatric population. Delirium is a transient, acute change in mentation of a patient, typically geriatrics, that can cause or present as confusion, paranoia, agitation, fear, restlessness, and aggression. And it's considered a medical emergency because it's a huge change in condition. It's been shown through continued research that prevention of delirium is paramount, as treatment of delirium does not seem to decrease the length of delirium or reverse its process. Delirium can increase length of stay, injury from falls, restraints, deconditioning because of lack of mobility, skin breakdown, and have lasting effects on patient independence and their return to the previous state of health or home in a lot of cases. The HELP program has a website that gives facility tools to assist in proposing to management this change in practice and implementing. It has all kinds of research that back it up. It is largely free for the public to use and includes a template for you to help figure out what the cost would be in implementation. The protocol includes interventions that can prevent delirium. This starts with the admission assessment that is administered by a geriatric nurse specialist that helps to determine the patient's baseline mental status and what interventions will be helpful to them. The patient will be then discussed at multidisciplinary rounds that include a geriatrician to determine what medications should be used or avoided, such as pain management and sleep aids. The orders are then reviewed to ensure that sleep interruptions are kept to a minimal, so vital signs are Q4 hours while awake, and medications are tending to be scheduled around sleep times. Uh, Dietary restrictions are minimal, and mobility and independence are maximized. So they have movement. So movement orders such as ambulate twice or three times a day, or physical therapy and occupational therapy are ordered. Staffing is educated to promote sleep with few interruptions and quiet dark rooms, so shades are drawn. Sleep masks are offered if that's a possibility, and vital signs are gotten around the sleep cycle. Sensory aids such as glasses and hearing aids are routinely used. They're requested from family members to be brought in, and it's ensured that the patient uses them. And meals are chosen by the patient. So fewer dietary restrictions, and if we are catering to what their tastes are, such as vegetarian, or maybe they don't care for pasta. These are used so that nutrition and hydration are maximized for the patient. We ensure that dentures are used, and we get rid of as many restrictive devices as we can, such as IV tubing or catheters. And this program advocates the use of volunteers. So volunteers are specially trained to assist the patients with mobilization when that's appropriate. They help with meals, they help reorient patients, they do visits, and they help to gather items such as playing cards or books, magazines, to ensure the patients stay as oriented as possible. When these interventions are all utilized together, the prevention of delirium is attainable. Thank you.